So hi, today we're going to talk about gallstones, that how gallstones are formed, and what are their signs and symptoms, their diagnostic and treatments. Okay, so moving to the next, that is talking about the gallstones introductions. So gallstones are hardened deposits that forms in the gallbladder. Okay, uh, a small organ that is located below the liver. So here we have liver, and next to it we have gall. We have that is gallbladder, and in that we can see a different that is deposits of gallstones. So they can vary in different size and cause significant discomfort and complications if they obstruct the bile ducts. Okay, so here we can see the bile duct, and from this that is from liver we can have right and left hepatic duct. Then we have they combine to form the common hepatic duct. Similarly, this bile duct and common hepatic duct join to form common bile duct. Okay, so obstructions can either be in bile duct here or can be in common bile duct. Okay, now before moving to the talking about the cause, we have to think about that why these biles are important. Okay, and how they are formed. So so actually these biles are important for digestions in the small intestine. Okay, and these are made up of different things like cholesterol. Okay, here we have that is cholesterol. Similarly, bilirubin, these bilirubins are coming from RBC destructions, and that is heme parts. Okay, similarly they consist different electrolytes. Okay, and then water, which help in movements of this bile to the different to the movement, its movement to the small part is intestine. Okay, so let us talk okay, and talking about the electrolytes, it is consisting like sodium, potassiums. Okay, bicarbonates, chlorides, etc. Now let us talk about the cause for the gallstones. Okay, so we have already discussed that biles consist cholesterol. Okay, but if these cholesterols are excessive, okay, that bile are converted into the gallstones. Okay, similarly bilirubins, if bilirubins are in excess amount, okay, and for a long period of time in gall bladder, okay, and it is not emptying, so it can also be the cause for formations of bile, that is formations of gallstones. Okay, so excess cholesterol in the bile, excess bilirubin in the bile, similarly reduced, that is emptying of gallstones. Similarly, the genetic factors are also very important for the formations of gallstones. Okay, now let us talk about okay, so let us talk about different signs and symptoms that are occurring during the gallstone formations. Okay, or due to the gallstones. Okay, so very first one, that is sign and symptoms, that is sudden and intense pain in upper right portions of the abdomen. So if we divide the abdomen into four different parts, that is the right upper. Okay, uh, upper right, that is upper left, low that is the lower right and lower left. Okay, so so the liver present in and also the gall bladder is present in uh, this right upper quadrant. Okay, so the very first one, sign symptoms, is like a sudden and intense pain in these right upper portions of abdomen. Similarly, this pain that radiates, okay, back pain between the shoulder blades. Okay, so this pain also occurring between the two different, that is the shoulder blades. Okay, and next sign and symptoms are pain in the right shoulder. Okay, now nausea and vomiting can be seen. Similarly, the jaundice can be seen sometimes. Okay, clay colored stools and fevers and chills are mainly seen in this patient. Okay, so here we can see jaundice, nausea and vomiting, pain in the right upper quadrant, nausea and vomiting, change in urine. Okay, occurs in bowel movements. Okay, now here we can see about the diagnostic test. Okay, that what are the diagnostic tests that is important for the gallstones. Okay, so very first one is ultrasound. So this is the most common test for gallstones, diagnosing gallstones. It uses sound waves to create images of shoulder of the that is gallbladders, and can identify the presence of gallstones. So here we can see the CT scans of that is gallstones. So here we have liver part. Okay, and here we have gall bladder, and in this we can see there this one that is gallstone. Okay, so diagnostic, that is CT scan, a computed tomography CT can scan can be performed to look for any complications of gallstones. Okay, similarly the next one is blood test. So the presence, so these tests can help access liver functions. Okay, and checks for sign of infections and obstructions. Okay, so a different test can be done in the blood test, that is like a AST, ALT. Okay, we can see their elevations, and also these infections are seen. Okay, so if here we can see if obstructions is either in the bile duct or in common or in the common bile duct. Okay, so that lead to accumulations of gallstone, or that is the bile for long period of time in this gall bladder. Okay, and that leads to cause infections. Okay, inflammations in this gallbladder. Okay, so we discuss about gall that is blood test also. Now the third one is we have CT scan. We have already discussed about CT scan. So ultrasound can very effective. Okay, in this case, similarly CT scan is also very effective to evaluate, to diagnose gallstones cases. Okay, similarly the blood test we have already discussed about. Now let us move to the treatment portions, that uh, so the very first one is like watching, that is watchful waiting. If the gallstones are causing symptoms, the doctor may recommend a wait and see approach. Okay, means this is the initial cases. uh, Now talking about the surgery portions. The most common treatment for symptomatic gallstones is surgical removal of gallbladder. Okay, and known as cholecystectomy. Okay, this is often done either by laparoscopy and is considered safe and effective. Okay, so either it can be done through the laparoscopic, or through the open surgery also it can be performed. Okay, so here we can see the laparoscopic. Okay, so cholecystectomy is done and removed the gallstones. Now treatment also includes medications. So certain medications can be prescribed to dissolve gallstones, although this process is often slow and not effective for everyone. Okay, so medications, in the medications portions, different painkillers are also given. Similarly, these gallstones dissolves, so that it can, so that the gallstones can dissolves. Okay, so some medications are also given so that they can dissolve gallstones. But it is not very effective, it is a slow process. Okay, okay, this much for gallstones. Thank you so much for your attention.